News 10 presents Dialogue, a weekly public affairs program exploring community concerns and spotlighting regional activities.
And good Sunday morning to you, everybody. The clock is ticking. We're getting down to the wire. This is the last Sunday before Christmas, and you know, by now we all could use a break. If you are a caregiver, we know you could use a break. Well, my guests are here today to talk a little bit about some things we need to be on the lookout, I should say, for this holiday season, and what we need to be watching for. And there may be some of you who are caregivers who need a break. I'm talking with Eshonda Blue, who is the CEO and co-founder of Innovative Senior Solutions, as well as Jessica Wright Finch, who is the COO and co-founder of Innovative Senior Solutions. Good to see both of you, as you are in your 18th year.
Yes.
And I sort of remember the early days,
yes,
way back then, and then you're just building, you know, on what you started. And what you started is, I guess, locations, centers that provides what, adult daycare?
Well, we actually started with home care back in 2017, and it was our grandmother who could no longer stay home by herself, and she told us she didn't want to go to a nursing home, and we wanted her to be able to stay home. So we actually started out doing home care, and we did that for about 13 years.
Yes.
And in 2019, we kind of pivoted. We sold the home care, and we pivoted into adult day.
And so who can, I guess, attend your centers or participate in activities that you provide at your center?
So adult day is, we call it the best daytime care. So that's what it is. It's daytime care. We keep them for the day. They go back home. It lets them stay home in their communities longer. And seniors can attend, of course, disabled adults and special need adults.
And so this is the holiday season, and then people are doing that last minute, you know, running around, shopping, whatever it is. But sometimes they just need a break, even if you're not a caregiver. But you provide opportunities for caregivers to have that break.
Most definitely. The Adult Day Center provides day respite, so they can come during the day. They can come as early as 8 o'clock, and they stay there until 2. They get breakfast and lunch, snacks. They get
just activities.
Yeah. They get activities. A nurse is there. Caregivers are there. So it's a structured place where the caregivers can have a peace of mind and know that their loved ones are being taken care of.
And you both are nurses, RNs,
we
right?
Are, yes.
So if somebody's interested in taking advantage of that break, how do they, I guess, you know, sign up?
Yes, well, they can call us at 866-409-0582.
Okay,
Yes,
0582.
0582.
That's correct.
You can check our website is innovativesenior-solutions.com. You can email us at info@innovativecaregiving.com. Just DM us, however you can get in
social
contact.
media. We're on all social media platforms, so definitely.
And so this last week leading up to Christmas, you have available space for new clients.
Yes.
Okay.
So we are actually running a program that will help caregivers with 25 days of free respite that we're really excited about, that we definitely will do a deeper dive
Yes.
about that.
Well, because one of the other things that I know you wanted to talk with and talk about, I should say, you know, whether you're traveling here to Albany or whether you're going somewhere else to visit your loved ones, you say this is the time to be on the lookout for changes in your senior loved one's behavior. So expand on that.
Well, we know that a lot of family live out of town, and you know, may not live in the same town with mom or dad. And usually holidays is when people come home and check on mom and dad. So this is a great time to start looking for early signs of Alzheimer's and dementia. And just to say the difference between Alzheimer's and dementia is like a umbrella term for any type of cognitive loss. And Alzheimer's is a type of dementia. And Alzheimer's is the #1 type of dementia. It is a disease that kills brain cells.
I was about to say, well, you used the word killed, and I was about to say there could be death resulting as a result of
the Alzheimer's disease, and it has different stages. It goes from early stage to stage 3 or 4, and one of the things that we've seen is that most family members don't even know about it until stage 3 or 4. They they bypass the early signs altogether. Because it's things that we don't really think about, which is what we want to talk about, is what are some of those early signs so that they can get treatment. You know, there are some treatments for early signs, but most importantly, it can help prevent a crisis or mom and dad walking off, wandering off.
And you're getting that phone call long distance saying something's going on with your parent. Well, what are some of the things they need to look out for?
So some subtle signs is the environment, right? When you come home, it's unkept, it's a lot of clutter, missed pills being taken, piles of letters, unpaid bills, spoiled foods in the refrigerator, things of that nature. Just looking around and seeing those things for the environment. As far as for emotional behaviors, they may be more forgetful, putting things in unfamiliar places, unusual places. So maybe you'll see keys in a cabinet, in the kitchen cabinet. So things are put in unfamiliar, unusual places. So definitely look out for that. Body odors just being unkept. Individual, you know, your loved one is very neat, is very tidy, but now you see that they're being unkept. It's odors, things of that nature that can be, you know, we may look and say these are subtle and don't think they're changes, but they are changes that could could be early signs of dementia or Alzheimer's.
Okay, so you know I shared with you a little bit earlier a significant date mix-up recently, and so I'm alarmed. I am alarmed, and you know, the question is, when might those types of things, should I be alarmed based on what I told you? I'm not sure I want to tell everybody, but you know, should I be alarmed if there's a significant date that you know and you've absolutely got it mixed up?
Yeah, that's it. You know, we got another story we can talk about menopause. I'm 51 now, so we have something they call it brain fog. So we might be experiencing some of that. But
well, I'll be frank about that. As my doctor said, I'm past that.
Okay.
But I'm diabetic. I do know that foggy brain and things like that can happen.
Yeah.
But so there may be some other medical explanations, but it really shook me. I'm like, how did this happen? How did I get it so wrong? And the keys, now one of the other little tricks I understand, that speaking of keys, that if you know, we all misplace the keys. Definitely. But if you look at the keys and you don't know what the keys are for, then that may be a red flag.
That is a red flag. And another red flag too is, so short-term memory loss is definitely a red flag, but usually when they cannot retract, or say you misplace something, because we misplace things all the time, but we can really retract our steps and say, well, let me just think about where I was, and you can kind of retract your steps. They're not able to do that. So that is one way to differentiate whether it's something really more and probably an early sign.
So what does, what should a family do if they start to recognize these signs?
Definitely set an appointment. Go ahead and call their primary physician, get them in, get them, you know, looked at, tested for those early detections, because there are screening that can be done to identify those signs for Alzheimer's dementia.
All right, let me do this. I want to give your contact information again, and when we come back, there's another hot issue, and maybe between now and when this dialogue airs, hopefully it will have been resolved. But we're going to be talking about the ACA, Affordable Care Act, and the impact that it could have on programs like yours and the families who need your services. But the best contact for them, 866-409-0582. And we also need to tell everybody the number of centers you have and where those centers are located. So stay with us, everybody, as we are in the last build-up run up to Christmas. And there are some things, some everyday things we still need to be aware of and cognizant of in terms of our senior loved ones. If you're a caregiver, we need to keep our eyes and our ears open. We'll talk more about that after the break. Stay with us. And welcome back to Dialogue on this Sunday before Christmas. If you are a caregiver and you need a little bit of a break, my guests are here today to tell you where you can, of course, find a safe place for your loved one if you just need the break or if you have errands to run. We will talk more about that program in just a moment. I'm still talking with Eshonda Blue, co-founder, chief executive officer of Innovative Senior Solutions, as well as Jessica Wright Finch, who is COO and co-founder, and 18 years now. 18 years. Let's talk about healthcare, because you are able to operate and offer the services that you offer because of insurance. Regardless of what kind it is, insurance helps to defray the cost.
Yes.
So talk about how this ACA big question mark, if it's not resolved yet, impacts your services.
You want me to get it? Well, for us in Georgia, and we've been told that we're going to be, for seniors, just for the special, because we get a special Medicaid waiver, and it's called CCSP and SOURCE, EDWP waivers. We've been told in Georgia that we're going to be okay because our governor was very conservative with our budget. And so the last we heard from our legislators is that we're going to be okay for those waivers, but they are cutting other things. So specifically for anybody that's on the EDWP waiver, I think we're okay.
And so for someone, a client, a family to want to utilize your services, they must be, what, at least 18?
Yes, 18 years or older, so you can be a disabled adult, or definitely we do seniors. We take seniors anyone 65 and older, and we special needs adults. So those are the individuals that we currently serve.
And does the family need to have insurance, or your the way you're set up? I mean, does that cover it?
Mostly community-based. For our community-based services, it is the EDWP, that's the Elderly, Blind, and Disabled waiver through Medicaid. Medicare does not cover community-based service because it's long-term care services, it's non-skilled services, so Medicare does not cover it. So Medicaid covers community-based services for individuals who's looking for adult day.
And you just mentioned skills, so let's talk about your staff. Both of you, again, are RNs. Talk about your medical staff and the care that's given during daycare for your seniors.
So we are a healthcare facility, and so a LPN is there, a nurse is there to oversee our caregivers, so we can identify changes in conditions sooner in our clients. With the nurse, we can provide anything in their scope. We can administer medications, we can do wound care, we can do blood sugars, tube feeding. You can do that all at the center. Our caregiver can help with any daily needs as far as toileting, feeding, so someone could really be wheelchair bound and still be able to come to our facility and get the care that they need, all while excuse me, getting socialization as well.
And again, giving the caregiver, be it, maybe it's a work, employment that they have to do. Can they come Monday through Friday? When are you open?
Yes, Monday through Friday, we open at 8, and they usually start going home around 2, and we also provide the transportation. So if a caregiver is interested in their loved one coming to the center while they're working, or they just need a break, whatever the case may be, we can pick them up and bring them back home.
And I mentioned during the last segment that, I remember close to 18 years ago when you came and talked about the homes, the facilities, those facilities then. But now you have 5 of these adult daycare centers. Share with us where they are, and we'll give the contact information again. And again, transportation available to each of your centers.
So we have a center in Americus, we have one here in Albany, we have one in Blakely, Georgia, Columbus, Georgia, and Valdosta, Georgia.
Okay, and was it Columbus was the last one you added?
Columbus was the last one we added, and she just corrected me. It's not Blakely, it's Baxley.
Baxley, I got you. But still, that's available for, is it a certain?
Yeah, 50-mile radius.
50,
so we
okay,
can
okay.
service anyone in a 50-mile radius from the center.
Okay, all right. I want to talk about this flexible care, the Medicare Guide program, giving families 25 free days of respite care.
Yes, yes. So it is a pilot program, and we've partnered with a company called Harmonic Health. And this partnership allows us to be able to offer 25 days of free respite for individuals with Alzheimer's or dementia. And even if they don't have the diagnosis, they too can apply, because what we know is a lot of people do not have the diagnosis. They got the symptoms, but they just haven't been assessed or diagnosed by a physician. So even if you have signs and symptoms, you need to let us know, because this program has a geriatric nurse practitioner on board that will go ahead and do the assessment for them.
Now, is this a national program?
It is a national program.
Wow. All right, so no out-of-pocket costs. The program covers all associated respite care services, eliminating financial barriers for families while ensuring seniors receive professional, compassionate support. So to sign up, and is it like, do you have to use the 25 days altogether, or is it like, if I need it this week, I can use the second day?
Yes, yes. So you have a whole year. You have a year to use the 25 days. They do have to be on Medicare, red, white, and blue. That's traditional plan. They cannot have enrolled in a Medicare Advantage plan.
Okay.
So they have to be on the traditional Medicare plan, long as they have that diagnosis or signs and symptoms of any type of memory loss. They can be assessed to see if they qualify for the program.
So how do they, I guess, get this started?
So just contact us, call us 866-409-0582. Also, if you're on social media, we do have links that you can go to and fill out the application. You go to our website, www.innovativesenior-solutions.com.
Or give you a call.
Yes.
Right? 866-409-0582. So this is awesome. This is awesome, especially being here in Southwest Georgia, that it's available to seniors who might could use, or I should say the caregivers, who could use this. Now, there's something else exciting that we're going to talk about after the break, still bringing the national spotlight to innovative senior solutions. We'll share that with you when we come back. Welcome back, everybody. I'm still talking with Eshonda Blue and Jessica Wright Finch from Innovative Senior Solutions. Some exciting news. First of all, our very own, this press release, CEO and co-founder Eshonda Blue, appointed as a nominee member of the 2026 Board of Directors for the National Adult Day Services Association, or you're also on the state board. What does that mean?
It means that I get to be on a board that looks at affecting policy for our industry, definitely talking to legislators to let them know about the importance of our work, but it impacts the industry, definitely impacts the industry.
And puts the spotlight on Southwest Georgia.
Yes.
And then you, of course, 40 Under 40 honoree for Georgia Trend magazine, and both of you working in your community in Americas, giving back.
Yes.
Speaking of giving back, you have a foundation.
Caring for Seniors Foundation. With this foundation, we put on our largest give back to the community, our senior festival. Last year we had over 500 attendees come out, and this is just where we have vendors who provide community-based services. And so we want to be able to make sure seniors or senior caregivers know what is available, what resources are available for them.
Well, and that has become a big deal.
Yes.
They look forward to that.
They do.
Now, you've also, I got to jump to the franchise. They've franchised everybody, one of 3?
One of 3 in the country.
And so that means that Innovative Senior Solutions might be in, what, Texas or?
Yes, yes.
How many franchises?
Well, we have 1 franchisee so
Okay.
far, but yeah, we have the ability to franchise all over the country now. Anyone who wants to invest and have their own center, they can actually go through our franchise.
Did you ever imagine?
Not
Did you
at the
ever
beginning, no.
imagine? That is awesome. Now, the other thing is there is now overnight respite care. Where is that available? And when you explain what you mean by overnight, I know, is it one night or is it a weekend or?
Whatever the caregiver needs to get that support, to get that relief, to get that recharge, we can do it. And this is where the individuals stay with us overnight. It could be one night, it could be a week, it could be several weeks, whatever that individual need to be able to be taken care of still in the community.
And so who can you, I guess the same type of client for the adult daycare would be able to utilize the overnight respite?
Yes, yes, they can live at home. They can be getting home care services.
Now, do you provide home care? That's what you sold.
That's what we used to do.
Okay,
yes,
okay.
yes.
I didn't know if you incorporated any of that.
Yeah.
But they can come to you. Where are those overnight respite locations?
We have one here in Albany, Georgia, Americus, Columbus, and Cordele.
Okay, and when you were here last, you talked about the silver tsunami.
Yes,
Let's talk more about the silver tsunami.
We're waving that flag because a lot of people don't know about the silver tsunami. It'll be here in 2030, and that's when there'll be more seniors on Earth than any other population. Seniors will be the largest population. It'll be over 73 million. There'll be more seniors than children 18 and under. What's another number?
Let's see, every 100 days, 1 million individuals turn age 65.
Okay, so is that, what is the official number to be considered a senior? I know I am one, but I was shocked. I think 50, is it 50 for some? I know AARP, they start before
very
50,
young.
Right? So 65.
Yeah, so in 2030, all of the individuals in the baby boomer will have boomed. They all have reached the age of 65 by 2030.
Okay, and so again, if somebody wants to take advantage of this new flexible care settings, no out-of-pocket cost, and as you said, this is new, the 25 days of free respite care. They can call you 866-409-0582,
Yes.
or they can email you at innovativeseniorsolutions.com. Find your website there.
Yes, yes.
And again, holidays, to sign up for the holidays, if you need a day, if you need a couple of days, your hours again, Monday
through Friday, 8 to 2.
And what about for was
overnight?
And Christmas Eve? What about?
Yes, we'll be there. We're closed just on Christmas Day, so anyone who's needing day respite, they can definitely do that at our center. Or if you're looking for overnight respite, you can do it at our location. We're never closed there, so any day you can come and do overnight respite.
Okay. Again, the best contact information 866-409-0582. And then the innovativeseniorsolutions.com, they've got information there. And there was another email.
Info at innovativecaregiving.com.
Okay. Thank you for what you do. Thank you for what you do. And Merry Christmas to you and your family.
Same to you.
And Merry Christmas to you, everybody. Have a great one.